Well, we're moving into the last forum for before lunch. And I want to call our moderator, all right, Dr. Sean. He's going to be moderating this forum with two expert panelists about the digital divide. Why clinicians must embrace digital health. I'm in total agreement. I haven't embraced it well, but I'm attempting. And his two expert panelists, Mr. G. Saravanan, who's the Chief Information Officer at the National Cancer Society, and Dr. Jason T., also a digital practitioner, health practitioner, who was our moderator earlier. Welcome, gentlemen. The mics are right there on stage.
Hello.
Please everyone. Give them a warm, lukewarm. Yeah, that's good. Thank you very much.
All right, let's get comfortable. How are both of you?
Good.
Right. So thank you very much. It has been a very busy conference these past 2 days, and I'm very cognizant of the fact that we are the last barrier before we go to lunch. So let's keep this concise, right?
Is it 30 minutes or 1 hour?
It's supposed to be 1 hour.
Okay.
But this is a timing.
Okay.
Right. So welcome to this session. It was very insightful for us to actually listen to the session earlier. I was speaking to Dr. Jason behind, and we were saying that, if you look at some of the technology that we have today, when I was doing my housemanship about 8-10 years ago, life would have been so different. If I want to set a line, I don't have to worry so much about banking. It is so much more convenient today. Now, in modern healthcare, clinical expertise alone is no longer enough, right? Because we look at all the technology that we have today, digital health has rapidly transformed healthcare. So, doctors who lack digital fluency may struggle in the future itself. And I think this is an important call that we are going to revolve around today. So, over here, I'm delighted to have with us two experts who will unpack this session. Mr. G. Saravanan, Advisor and Chief... Sorry? Let's call me G. I am G. So G, Advisor and Chief Information Officer at the National Cancer Society of Malaysia, and so Dr. Jason T, Digital Health Practitioner with HIMSS. Right, so let's dive in. I think to set the stage, I would like to invite both of you to actually share with us your perspective on the digital divide in healthcare today. What it means, what it matters to Malaysia. Maybe you want to begin with G?
Okay, thank you. Hi. I'll give an introduction first. So firstly, I think the question originally which was drafted was, where is the digital divide? Is it within the hospital? Is it in the urban area, rural area, and so on? Actually, the digital divide happens everywhere. Pick the most modern hospital, the most automated hospital you can find. It happens within the hospital itself, actually. It happens between the doctors who actually spend the time, extra time to learn the tools up, as well as against the doctors who don't spend the time for whatever reason. So that's where it happens. And just now you mentioned that the doctors will suffer or will have issues in the future, right? Actually, no, it's happening now as we speak. And it's not so much of the clinical practice, it happens because of doing various other reasons. You cannot run hospital just by having doctors running the hospital. You need to have n number of other roles, other departments, billing, registration, administration, insurance claims, and lab orders, and this and that. So every other part of the hospital will suffer when the main input does not come in a digitized format. That's the crux of the matter. And obviously the main input here is expected to come from the doctor. So that's the root, so I don't say root of all the problems, but it slows down the whole process, as versus to doctors who practice digitally. Right? I'll just pause there and let Jason say a few words.
So I think digital divide to me, what it means is that it applies to the consumer. So the person who's actually using the technology. So let's take our smartphone, for example. This is the simplest analogy, simplest examples. So the digital divide, before we talk about the doctors, let's talk about our daily, day-to-day practices as well. A lot of the things that we do now is everything is online today. So of course we do have family members who refuse to use technology. Like for example, like banking is so much easier today, but there are still people going to the bank. They rather queue up. They rather take the queue number, go to the bank physically, and all. So there are reasons why it's as such. because as a consumer, they find that probably it's safer. You know, they're probably used to these processes. They're used to doing all these things manually. So coming back, applying this same analogy to healthcare, so the consumer here, the user here is actually not only the doctors. Actually, I would expand it, you know, towards the nurses as well. Even healthcare administrators, they themselves are also the consumer and the user of technologies. So the divide here is when, same thing, these consumers are not using these tools as what is meant, what is supposed to be. Same goes to our smartphone. There's a lot of use to it, a lot of functionalities, but most of the time we only use two functions, email and WhatsApp. But you can use a smartphone to organize your life, to organize your, you know, everyday work life, and to make it more efficient and all. So digital divide it's a huge scope. It's a big umbrella of what it means. But from a healthcare perspective, this digital divide will actually it will not benefit the ones who are not adopting the digital tools. So I would define it in such a...
Yeah, I mean, let me just... Oh, okay, please.
Can I just add a bit more to what I mentioned earlier, right? To really paint the picture, right? A digital divide which happens within a hospital. So many hospitals right now already has an EMR. At the same time, we have many doctors within the same hospital who don't want to use EMR for whatever reason. Take two doctors in the same hospital. First doctor uses EMR. All the prescription orders are entered into the system, especially prescription, whether it's day-to-day or during discharge. Those prescription data, take a guess how long it takes to reach the pharmacy for the dispensing to be happening to the patient. It's instant, am I right? Compared with the doctor who does it manually, take a guess how long does it take?
Confirms will be longer.
Give me a number. How long?
2-3 times longer.
Minutes?
30 minutes.
You'll be lucky if it reaches within 45 minutes. We are talking about a paper which has to move from the inpatient ward where the patients are actually admitted to the ground floor pharmacy or the first floor pharmacy, right? And that depends on human porters. Porters, a typical hospital will have about 20 to 30 porters. So just imagine how long it takes. So easily we're talking about 1 hour. 1 minute against 1 hour. That's how much hospitals will suffer, and digital divide happens within the same hospital. Thank you.
Yeah, I think what I get from the both of you is that these tools actually already exist. Although it's rudimentary, you know, there are definitely ways to improve on the tools, but the tools are already in our hospitals itself. It's just that perhaps it comes down to readiness of the healthcare workers to actually utilize it. I think over here I can share my experience lah. So like even myself when I was doing my when I was in my various hospitals, there are actually people who are actually able to use it, and these are usually the younger doctors who are actually using the tools faster anyway compared to the slightly elder practitioners, and definitely is going to affect, and we can actually see the difference when you mention 45 minutes difference in regards to that. So, Dr. Jason, just wanted to ask you, right? Do you see any common patterns or similarities in regards to how digital divide shows up across the healthcare systems across the world?
Yeah, so if you look at healthcare systems in general, the whole purpose of digitization is digitalization. So you see, you must be careful. Digitalization, two different meanings. So the whole purpose of digitalization is actually to improve outcomes, right? You want to make sure that doctors work faster, patient care gets safer, more efficient, cost gets reduced. So essentially, that is the main goal and objective. So the common thing that we see across, not only in Malaysia, even Southeast Asia, there are different countries around the world. I would say that the most common problem that all these healthcare systems face is actually user adoption. So in this case would be the healthcare provider adoption. So like I said, I try not to just say that it's a clinician thing, but even all your allied health providers as well, most of them, if they struggle to use the system, the efficiency of your processes and your systems will be impacted. So I see that common. And one more thing as well is that in terms of digital literacy, so again, as providers, healthcare providers, we are experts in clinical terms. We are experts in combining symptoms and syndromes and making diagnoses, understanding what kind of tests we need to run and all. But when it comes to understanding what processes actually means when it's conducted electronically, for example, one of the terms will be closed-loop medication process. What is clinical decision support using tools, for example? So a lot of these terms are not well understood. So when these terms are not well understood, it is very difficult for the clinicians to actually understand the value and to really understand what it actually means to use this functionality as an example. So these are just some, I mean, the practice of medicine is there. If you look at the care protocols, if you look at care algorithm, it is all there. So for instance, if you have a patient with acute myocardial infarction, the protocols are all there. What do you need to do? Airway, drugs, etc., pain management and all the protocols are all there. But the question is, as a provider, how do you digitalize these care protocols into a computer form or electronic form to make the care team work more efficiently? So that is actually one of the hardest things. And I see it common across, it's not only in Malaysia, but a lot of healthcare systems across the world, even developed nations as well. A lot of them struggle with adoption.
Yeah, no, the very interesting thing that you mentioned over here is in regards to that, because a lot of doctors, right, or healthcare workers, we talk about pharmacists, talk about nurses, they come with a mindset that, I'm taught in medical school, nursing school, dental school to actually speak to patients, treat patients, not to work on a computer system. How do we reconcile that idea? How do we make people more?
So the focus is, okay, so I'll try to bring one topic in one at a time. So the topic here that is trending today is a lot on physician burnout. So the reason why physician burnout, because there's many reasons, right? Can be a tech thing, can be a processes thing. But the whole purpose of care is actually to spend more time with the patients, to understand the patients better, to also ensure that you find time to clerk and to speak to your patient to a point where you really understand what your patient is going on. But the problem is a lot of healthcare processes today, even in manual processes as well, it really takes a lot of time. So back to one of G's questions just now, how long do you think it takes just to order a medication and for the medication to actually come to the ward and all? You'll be lucky to get 45 minutes. But we are talking about how do we actually make sure that we can cut all these red tapes and all these inefficient processes to down probably to a couple of seconds or even a single-digit minute, for example. So we want to make sure that all these times are saved. We want to make sure that we can free clinicians' time, not only clinicians' time, even nurses' time as well, free up their time so that they can spend more time on patient care. Otherwise, a lot of the time, if they're trying to deal with reports, they're trying to deal with, making sure that they document everything with pen and paper, it takes up so much of that time that they can't even get home on time. They can't even go home on time. So we want, the whole purpose of making sure that digital transformation is successful is to make sure that all these care provider gets time back to the patients, so they are able to provide time back to the patient. That's the whole purpose.
Yeah, this would be more about automating the things that do not require clinician input. So like for example, just to paint a bit of picture. So last time, back in those days, right, when we want to prescribe medication, we need to take a piece of paper, write the thing, then we need to tear it
forms,
out.
manual forms.
Forms, give it to someone to go down the pharmacy, get the medicine, come up. So nowadays, if you actually just have a computer, just click a few, send the order down the pharmacy sends the robot up, with automated, then we can actually save a lot of the human, and then it frees out the humans actually to do the clinical work.
Correct. One example, sorry, Ajay, I just want to one more example is during my time as a housemanship as well, especially for dengue cases, when I draw the blood, I have to physically run to the lab, send the bloods there, wait for the blood results, wait for the lab to print it out. I would then carry the results, run back up to my ward. So nowadays, I'm not sure whether hospitals are still doing that, but nowadays, all these are electronized, these are all done electronically already. Why do you still need to wait there, call the labs and say, hey, is it ready or not? So there's no point for it anymore. So that's the whole reason, that's the whole benefit of digitalization, is to make sure that your doctors don't waste time waiting at the lab, don't waste time going down to the labs. So that's the whole purpose.
Speaking to you reminds me of those days. 6 o'clock, take the blood, run down to the lab, get the result slips, come back out right on the piece of paper. Well, back in those days. So, G, moving to you, I just wanted to know, right, from your perspective, working with hospitals, what are the basic digital skills that clinical workers need to have?
Okay, before I jump to what skills doctors need to have, right? A few words from what Jason said just now. You try to define it, but let me just put it down, which I think is very, very important. Because doctors obviously are not trained in IT, right? So when you have an IT guy coming talking to you that, oh, we're going to do this project, we're going to have this software, right? There's three main aspects which has to be learned actually. Number one, digitizing. You tried to say the word just now, right? Digitizing. Your data, or right now it's paper, has to be digitized into a computer format. It's either the software or the PDF file or Word file or Excel file, some sort of digital format. That's number one, digitizing. Second is actually, what did you say just now?
Digitalization.
Digitalization, right? With an S or the Z, depends whether you're medically trained or British trained. It's up to you. But the second part is no longer about data. Your data is already digitized, right? The next thing is actually automating that because, or rather workflow, automating the workflow. No point having a digital data, but your operation is still manual. So number one is data, number two is actually the SOP or workflow. That's number two. All right. Now the number three is where the big word comes in, digital transformation. Now digital transformation got nothing to do with the technology people, unlike many people's belief. Digital transformation is how you change your entire business or how the whole hospital operates or wherever you come from operates to become, transforming business-wise. That's the main thing. You get these three things done and you're good to go. Anyway, what's the question again?
Skill, what are the minimal level?
What's a skill? Okay.
Yeah, what's a skill?
Very similar. Okay, forget about, just for 1 second, put aside and don't think of yourself as a doctor. I know you are one, but just for 1 second. If you were given advice early on in your career, how to move up in your career, obviously you are trained in your own profession, your own vertical, in your own industry. You have your hard skills about your industry. Besides hard skills, what are the other skills you need? Anyone? Soft skills. Opposite of hard is? Thank you very much. I know it's like near lunch, right? Sebelum ngantuk kan? Okay, so opposite of hard skills, your soft skills, how you talk, how you communicate, how you present, how you write, so on and so forth. Very, very similar. Doctors have to be trained with the tech soft skills. So being a doctor, besides doing your day-to-day job, you need to have a lot of other skills. For example, how you talk to your patients, right? Similarly, doctors need to have IT soft skills. So I can go on saying that you must be good in, I don't want to name any product names, this EMR or that EMR. But before talking about EMR, because you can never keep up with EMRs. EMR is actually your software, right? You need to know the basics of IT. How to use keyboard, how to use mouse, how to use shortcuts. This makes your life easier. Not very easy, but a bit easier. Once you know these tips and tricks, right, of the soft skills, then using any EMR software, any digital software becomes easier. The problem with most IT guys is they rush the doctor to use a particular software. What is that? Huh? A particular software. All right? That's the major thing. So I don't want to go into details here, but soft IT skills are crucial. How to use computer, in other words, because you are not taught to do that in your medical school.
No, please go on.
Yeah, I think just to add on to what G mentioned about IT skills, soft IT skills, right? So I think you will, so the more you're familiar with computers, the more you'll be able to figure out quickly how to use the electronic medical record system. Why I say that? Because again, not every electronic medical record system is designed the same as well. Most of the time, it looks easy on paper. I want to order a blood. All I need to do is tear the sheet of paper, write down all the list of results of the test, sign off, and then pass it on forward. But when you look at computer screen, again, sometimes the computer screen has buttons where most of the time you do not recognize. It's obvious it's there, right? The order button is there, but because you are not familiar how a user interface is going to look like, how the graphical user interface is going to look like, you end up spending more time trying to figure out how to even order a blood when this can be solved by just a matter of seconds, right? So hence that is why it is very important to familiarize with all these processes, familiarize with what what an order button actually do look like. So I'll just pull out one example. If you look at a lot of your e-commerce platform today, the cart, that shopping cart, standard, right? Every time when you want to know what have you purchased or what is still pending in your shopping cart, you don't even need to look at what's written. All you need to look at is only that icon, right? So a lot of these are all, I would say, probably IT intuition. At the moment you look at it, you already know, okay, I'm just going to go ahead and click at the button. I already know what's pending. So same as well. So for IT systems, there is actually a need for standards, where when they design an electronic medical record system, they must put it in a way where the moment the doctor looked at the screen, they already know that, okay, if I'm going to look at my lab results, that is that particular icon that I'm going to click at. No questions asked, right? So I think coming back to all this, what are the skills? I think the skills of getting familiarized with computer systems, I think is very, very important.
I want to add on something.
Yeah.
Okay, the number one reason you need to have the soft skills, obviously, for you to use the software. But there's another big reason why you need to have this. Now, the reasons are, or the reasons is this. Besides using, it's very common for your IT guy or for your management, when they're about to implement EMR software, to come to you and ask you, doctor, how would you like to have it? Okay? That means they are gathering requirements. Somebody called business analyst or project manager come and ask you. At that point of time, most of the doctors will reply this way: how am I supposed to know? You are the IT guy. You're supposed to tell me. But guess what? Your IT guy right now is giving you an opportunity for you to give comments. If you don't have the skill or background or soft skill of IT, right, you will not be able to articulate. Some of the best EMR system are driven by the doctors. So please don't give in to your IT guy and end up having an IT system as opposed to a system which the doctor wants, right?
Oh, you're talking about the EMR itself, right? So actually there's one item over here that's really intriguing, which is that in Malaysia itself, not all hospitals actually use the same one. I know Jason, you mentioned about, just it has to be standardized, right? If you should see the icon, you should be able to recognize that, oh, that's for me to send the bloods, that's for me to hit the discharge summary. But in this fractured system in Malaysia right now, what can we do to actually unify the situation?
I think you need to have standards. Yeah. So I think you need to have standards. So again, probably not everybody understand what we meant when we use the word standards. So standards in this case would be a list of items, how an EMR should be designed, what kind of processes should be in place, what are you measuring out from that system has to be in place as well. Because a lot of the time when you don't put all these standards in place, an IT company will just design something for you just because you are telling them that, hey, I just want to make sure that my doctors can put in orders electronically. Now, what does that mean for the IT people? To the IT people will be codes at the back end, how are they going to code the Python and things like that. But from an actual user perspective, that is where you need to be able to communicate with your IT people and say that, okay, you know what? I think based on collective standards, this is how we have seen how the world has done it. If your doctor is going to order something electronically, make sure that there are specific workflows and a specific set of images or user interface that will allow the doctor to just easily put in an order. So again, the standards are there. There are available standards that are out there. But I think the issue here is because, like what G mentioned, a lot of the time when you tell an IT company to do something, they will just build it using the IT hat. But they don't build it based on standards. They don't build it based on how a clinical user should use it.
Yeah, I mean,
so
before I get to you,
Yeah.
no, I just wanted to mention one thing about, KKM is trying to push a one person, one record kind of system. But for me personally, I work in 4 different hospitals, and all 4 have got different systems. And then like one of it has got, when you take your history, you have got different boxes, like for family history, for medical history, all different boxes. Another hospital actually uses one note itself for everything for you to put inside. So when it comes to merging the systems together, it may be a bit challenging itself. G?
Okay, before I go there, you mentioned something just now. You said you're not sure how many hospitals in Malaysia have got systems, right? I need to address that. That's very, very important. If you go to government hospital, less than 15% out of the over 200 hospitals have got systems. over 15%, slightly above 15%. In private hospitals, almost every single hospital have some sort of system. But whether how much they use it is a question mark. All right? And then this question is?
Different systems.
How do we unify
Merge.
systems?
No, he finds it difficult when one hospital, they fill in history differently compared to the other hospital.
Okay.
Yeah.
Now, this is where, right, like what Jason mentioned just now, standards comes into play. And I'm not sure Jason's being very shy today. There's a standard called HIMSS. Now, HIMSS actually has a maturity model, all right, which every single hospital should benchmark themselves against. Obviously, Dr. Jason is actually a representative from HIMSS.
So we call it the Electronic Medical Records Adoption Model. So that adoption model has different focus areas from adoption perspective, outcome perspective, cybersecurity perspective, clinical user adoption perspective, and governance and structure perspective. So there's a lot of focus areas that dictates how a hospital, what are the standards that a hospital should follow when they are purchasing, either they are implementing, in the process of implementing, or either they are in the process of improvement. So these are standards.
So coming back to the question, how do you merge data together, right? If you actually follow the standards, it should be fairly easy. You can call it data migration, all right, of moving one data from one system to another system. It's fairly easy to be done. But if you don't follow a particular standard, right, whether you keep the data in a database, whether it's ICD-10 data, whether it's SNOMED City data, then you're asking for trouble. You will not be able to merge the data together.
Okay, I'm going to ask a rather subjective kind of question. We mentioned that clinicians must take the time to learn digital soft skills, learn IT skills. Would that be a challenge in regards to the person being not able to pick up these skills at all?
Of course. I think, as I mentioned, the first step is actually IT soft skill. If you don't invest your time in that, you have an issue, right? The number two is actually the motivation behind it. Why should I, assume I'm a doctor, learn these tools? I came to this hospital to practice medicine, look at patient and cure patient. Why should I do it? Now, this question should be answered in two ways. Number one, if you're in a government hospital, your motivation is different. If you're in a private hospital, your motivation is different. Let's talk about the private hospital first, which is the easier motivation, right? Give an example. How would I put this nicely? Yeah? Okay, we are in the private sector to, of course, to treat patients, but obviously to make money as well. Now, one simple example, if you don't digitize your data, come next year with all the insurance ruling coming into play, strictly, right? The amount of time you'll take to actually get your reimbursement of your claims, of your payment, of your fees from insurance will take double amount of time, or probably more, as compared to when you digitize your data. And I'm not talking about you filling up your AIA portal for insurance claims and so on, okay, submission and so on. It's a lot more. Insurance companies are going to dictate that every hospital to have their own EMR, digitizing the record and submitting the data to them in a digitized format. So that's one motivation actually. So you need to be taught your soft skill, you need to have the motivation behind it. The third comes back to the hospital themselves. We need to start having enforcement. I know it sounds a very strong word, because if you do not sort of force the doctors in the facility to use the system, you will have different patient experience. Okay? Patients to a doctor who uses EMR will have different experience opposing to the patient who doesn't use system itself. Now the final one is actually cybersecurity. A lot of people are forgetting that when you start digitizing your data, your workflow, cybersecurity comes into play actually. And things are already quite serious with the recent amendments to PDPA, whereby I'm sure if you're practicing in a hospital, you'll have a person called DPO, Data Protection Officer, and his sole responsibility is to report any malpractice of data usage, data breach, data leak, even the way you share data, right? I'm sure if you open up your phone, you have easily about 500 different WhatsApp groups right now, 200 WhatsApp groups belonging to how you talk among doctors, and obviously being doctors, you share a lot. And among the data is your patient's record. That's a big no-no, right? So all this comes into play.
Right.
Yeah, go ahead. So just to add on to your question and to answer your question and what G mentioned, definitely there will be doctors who will not only struggle, they will do their best to tell you that I'm not going to use this. whether you take it or leave it, definitely there are. But I think coming back to his statement, it's all about motivation. So I think ultimately there is a need for a proper, in our world we call it change management process. So there will be a time where we need to be able to understand what actually motivates these doctors so that they will actually eventually use it, right? So another, just to add on very bluntly, would be if we can demonstrate that by using the system, they are able to save more time, they'll get paid faster, get paid more and all, then you will see a potential shift in behavior and then they will start adopting these technologies. So again, you need to kind of figure out, what motivates them to use it.
Yeah, no, when we talk about behavioral modification, we need to talk about rewards, we need to talk about punishment and stuff. But one paradigm shift that we can do is actually to instill it into medical curricula. So meaning that, when people are in school itself, in medical school itself, they actually learn and utilize this, because this is worldwide, this is global. Everyone is trying to move towards digitization. So that's very important. You mentioned something. You mentioned about cybersecurity. So when it comes to having data, those days you have got paper records. So if people want to steal data, they break in and take the data and run away. Now, cybersecurity is something very important. People can hack into systems, and in regards to and we also talk about, say, people may be worried about having their data being stored, sometimes by the government, and distrust is there. So what should the two things? What should the clinicians do to actually push for us to move towards that direction? And number two, what should the government do? Because you mentioned PDPA, so it means that the ministry itself should actually take some role too.
I think short answer is listen to your IT guys. That's the short answer. When it comes to cybersecurity, right, it's almost impossible for you to learn up many skills yourself because your focus is somewhere else. So in whatever setting you come from, you'll have some sort of IT guys there preaching or telling what needs to be done with regards to cybersecurity hygiene. Start from your own peripherals, from your own devices, where you practice. Use your phone, use your laptop, tablet. So there are certain hygiene practices. Have antivirus, the basic skill. Don't open up spam links, right? Don't open up, emails from YouTube, unknown from. These are basic cybersecurity hygiene. Because it starts from the link which you click, and it will end up with your data as well as your practice data being exposed on the dark web. And that will land anybody, you and your institution, in trouble, right? Besides that, the role gets bigger nowadays, actually, right? The role as well as the measures are different. The government have actually woken up. They have started, I think, 24th of September last year. Our Prime Minister have signed a Cybersecurity Act. It's an actual legal law which has nominated an agency for each industry. So under Ministry of Finance is Bank Negara. Fortunately or unfortunately, for Ministry of Health, the agency is Ministry of Health. They actually don't have, they have got the right motivation. We have got great friends over there, but they don't have the time, right? So for now, it's self-regulated. But trust me when I say that the patients are very much more educated nowadays. They know how to come after us. They know how to come after the physicians, after the hospitals, and so on. So take care, and the role called DPO is very important as well. And a lot of other institutions are jumping to the bandwagon. You've got MCMC, which is helping MOH right now as well. So come back to, you ask what should the MOH do, right? I think awareness is missing. If you go to the banking industry, fintech industry, Bank Negara is doing an excellent job in regards to awareness, keep your username, password, your banking secure. When it comes to healthcare, you don't see much about it, yet the rush to get on the digitization or the AI bandwagon is so much. I know many doctors who upload the patient data to ChatGPTs and get a second opinion and so on. Not wrong, but you need to know what you're doing. You're actually exposing patient data to public, LLM, large language model, and so on. So again, basic hygiene is important. So from the ministry, awareness is important. Thanks.
Is there anything to add to this?
Just very briefly, so he mentioned about, I personally have received text messages from within the doctors group where they took a picture. So when they took a photo of a patient notes on the computer screen without redacting the patient's name and, I mean, the identifiable information. So again, from a doctor's perspective, maybe they find that, oh, this is nothing, right? Who's going to know, you know, the MRN or whatever? But again, it's all about the basic fundamentals of cyber hygiene. And actually, in fact, even in med school, we do learn about it. I think we learn about medical ethics and all. So it's just that when it comes to real practice and all, sometimes we just don't, we don't put it into practice as we do on a daily basis. So I think that's why it's very important as well. Just make sure that if you're going to use the tool, if you're going to seek help from the internet or whatnot, just make sure that you have all these basic awareness in place, just to make sure that, you know, at least you redact or blanco patient's name or identify information. So I think that's very important. So not even to a point where it is so sensitive, where even age and suspected correlation diagnosis, somehow, if somebody is able to figure out, I know which patient you're talking about, it is also a risk as well. So I think this, you see, it's a big topic, but again, all this the awareness needs to be there. The willingness or the interest to actually drive on it is very important.
Awareness, willingness, very important things. We mentioned large language models, so I think this is something that there is actually someone who actually sent a message asking particular questions on this. When we talk about using AI in our practice, right, and we're not talking about using the general ones like ChatGPT or DeepSeek. We're talking about, say, the tools that we are having for the healthcare industry. When AI makes a mistake, who pays the price?
Okay, let's go to some basic definition. Way before AI, we already had this issue whereby doctors generally can operate with assistance of some sort of system. It can be IT hardware, IT software. So when it comes to Malaysia, this is the way it goes. Assuming you are performing a telesurgery, that means you are operating, doing a surgery remotely. For that operation, even if some decision is taken by that equipment, right, there has to be a human doctor name behind it, which takes the liability. Same thing for LLM as well, AI as well. Even though decision is actually driven by the doctor, driven by the LLM, or decision made by the LLM, there has to be a human doctor with obviously MMC number, registration number, driven, right? So that's the person who's liable. Secondly, it's actually the institution themselves. So both the physician and where the doctor is operating is fully liable for the practice. And I know at least 3 cases in the court right now, which is for this particular purpose. I know, very sticky topic.
So to inference that question, so if a lab test produces a wrong results, who's liable? The doc. And then the doctor makes a wrong decision because of the lab results. Who's liable? For me, I inferenced the question the same because ultimately, you talk about AI and all, it should be used as an adjunct, a tool to assist with the clinician's decision. But the doctor should not 100% say that, oh, you know what, this is what the results say, this is what the AI output says, I'm just going to follow blindly. Then you are not doing, So I think it really needs to be in a way where for me, how we diagnose certain clinical conditions it is supported by lab results, it is supported by certain diagnostical criteria. Same goes to today's AI tools as well. If the Gen AI is telling you something, it should be used as a supportive tool to help aid with your decisions. It is not meant to say that, you know what, I'm just going to believe whatever the output says, right? So I think it has to be inferred the same way. So again, all these tests and all, has they gone through clinical sensitivity, specificity tests, regulation, certification and all. So I believe how AI is going to be used has to go through the same process as well. It has to be validated, it has to be safe for the clinicians to actually rely on it as an adjunct.
That's a good point. But most importantly, AI or tools that we use should be supplementary, but not to replace a human. Now, we have got a bit more than 7 minutes. Just wondering if there's anyone in the crowd who has any questions that you want to ask. Anyone has any questions?
Well, we're going to put up that QR code, and then they will anonymously,
While waiting for the questions to come up, let me just share.
Oh, shy
a few words.
guys. Well, anyone courageous, brave today? Put up your hand and ask a question. Quite relevant to a lot of us practicing doctors to use artificial intelligence in the spectrum of management. Like he said, if something goes wrong with the result and then you still treat the patient based on that result, who is like, okay, if I'm the patient, who would I think is going to be liable? To me. I don't think I'm going to blame the lab. It's so guys, just
Correlate clinically.
can see all typing. Anyone want to put up your hand and ask a question? No? Yes? Oh, she was scratching her head. Sorry.
So Vishnu,
There.
just to add to your point, so even if you look at radiology results, at the end, correlate clinically.
Yeah. Keywords. Huh?
Okay, so we have got a couple questions, but G wants to address.
Yeah. Right now, if you get some sort of result from ChatGPT and you go and show this to someone, the first question asked is, has a doctor seen this? Have you verified this with a human doctor? Right? That's the current situation. But in the future, if you get a result from a doctor, what's going to happen is people are going to ask the doctor, have you verified this with the AI, or this is only human output? That's what's going to happen. So it's going to be a tricky situation in the future. So let's operate our practice in line with that. So let's take the questions.
All right, so we have got two questions here. I think we can combine them and answer together. So first one is actually with limited
Data
AI
cloud.
EMR adoption, how realistic is AI integration? That's one. And number two, will digital health turns doctor into data clerks?
I'll just give a quick answer. Now, that's a very good question. Obviously, without EMR being fully implemented KKM, we can't even talk about AI integration KKM. But having said that, also remember this. We are looking at AI as all connected, fully comprehensive AI-based EMR. But AI can also live in silo. A specific surgery, a specific practice, a specific doctor can also adopt AI. So the use cases for AI is actually very, very elaborate. Don't limit ourselves that, oh, no EMR, we can't use AI. No such thing. That's a short answer.
So probably I'll take the question on being data clerks. So I think, again, depends on how do you structure the context of this question. Because to me, even without digital health tools, when we are writing our notes manually on pen and paper, aren't we data clerks too? So I just want to make sure that the context of the question is correct. So making sure that you ask the right question, because to me, it is not about making doctors data clerks. It is about making sure that what is documented is clinically relevant and it's high quality data that is being input into the system. And because of that as well, it is also very important to ensure that what you are putting into the system is relevant. Otherwise, if you go back to pen and paper practices, you will also see a lot of notes that are, if you browse through it, it's the same, like one houseman after another, one MO after another. When you see the way they write their notes, it's the same thing, right? Whatever they wrote yesterday, they just copy and paste every single thing. So again, the question is, are you data clerks in this case, right? So the whole reason why digital tools are there is actually to make doctors' life easier. Again, are you saying that you're trying to make me a data clerk? Actually, it is not, because systems are designed to make and to improve how you are going to put in data. So that's why you have proper forms and templates. You have proper standards in place where if you are going to document a certain SOAP notes, certain SOAP notes are already structured in a way where you only put in clinically relevant information into the template. And if you're going to order any medications, that's why you have things like order sets, you have things like pathways, so that it makes your job easier as you progress, as you document your notes. So again, it's a long answer to that question, but my answer is no. We are not actually turning doctors into data clerks, but we are actually turning doctors into providing care in a way where providing standards of care to patients using technology to make sure care is safer, better, and higher quality.
How dare you call Dr. Jason become data clerk? He's so offended. Anyway, I really want to address that. Short answer is no. And there's something very, very important everybody has to understand. We are not only talking about data being fed into the system via the keyboard and the mouse by the doctor. Please move away from that mindset. Because along with the development of AI, we also have various other data capturing methods, right? We're talking about IoT. So patient symptoms, patient situation can be automatically captured using IoT devices, which is fixed on the patient, whether the patient is within the hospital setting, within the house setting, you know my hospital, right? I spell hospital differently. I spell it HOUSEPITAL, don't laugh, okay? Because the hospital service should start and should not stop. It should start from your house, right? The fact that we are still talking about practice of medicine only happens and data capture of patients only happen within hospital doesn't work anymore because all of us are walking around with Samsung and Garmin and Apple and so on, right? Before I blabber my way through.
Yeah, very quickly. So talking about data classes to add on. So
See,
today,
he's still pissed off. He's
yeah,
still
today
angry,
we have this
so
technology
offended.
called ambient AI, where you just converse with a patient, and then the tools will just pick up what you're talking about and then put it into structured notes and all. But again, as a user, you must also know how to clerk, what are the right questions to ask. These are all standards, right? So that the AI will be able to pick up and really understand, yeah, this is your question to the patient. I'm going to put it as part of the clerking. This is what you are going to order. I'm going to put this as part of the order. So again, it's a tool, but as a user, you must be able to understand how to actually use it, how to clerk the patients in a way where it's meaningful. So yeah, so just some input.
Yeah, no, this is really important. Actually, it comes back down to how we are actually being trained as well. Because when it comes to writing, even in writing, whatever prompt, so if you think of prompting, meaning, if prompts today may mean the things that you type into ChatGPT, right? But it is also what you write on the note itself. The first person who writes, if you write wrongly, then everybody else copy the same thing. The 2 days later, the results will also be wrong because what you put it in, garbage out lah. Okay, so actually we are running out of time. So I would like to thank both our speakers, G and also Jason. Thanks for a rich discussion. I think a few key important things that we spoke just now lah. So digital divide is not just about infrastructure; it's also about the systems, it's also about the people. Digital literacy is a clinical competency, right? It's not an optional skill already, and also. Institutions also and individuals share responsibility in building up this system, the capacity, and also AI and data governance require clinician engagement, right? And clinicians cannot be separated from this. So right, before we end this thing, can I ask both of you just one sentence of advice or one main key takeaway that you want our audience to have?
Use the system and use it well because it will benefit your practice. It will make your life so much easier. That would be my takeaway.
Use the system.
Get your motivation right, because the main complaint is IT takes too long. But if you say IT takes too long, right, but if IT becomes a crucial part of your practice, then will you say it's too long? So get your motivation right. IT is no longer an obstacle, it's actually an enabler.
Get the motivation right. So thank you both, and thank you to our audience. Let's continue this conversation not just within this room. It has to go beyond this room because digital future of healthcare is already here. So
thank you.
Enjoy your lunch.
That was awesome. Thank you. A round of applause, guys. There was a question you guys didn't answer.
Yeah.
Did you? I'm not sure. Where if the patient is in the presence of the doctor and the device that he's using, and they are not in sync. The device is giving some other information, the patient is able to see it, and the doctor is giving the patient contrasting information. How does the doctor actually deal with that situation where he has cast doubts and aspersions onto his patient? I mean, the AI is not the doctor for the patient. So how would you just to shed some light? I mean, it's not easy to
Excellent question, and this is not only relevant now. This question has been coming up for the past 5 years easily, and I'll tell you why. There's something called Clinical Decision Support System, CDSS, in any hospital which has implemented full EMR. When the doctor either prescribing or diagnosing and so on, the software can load up and ask, doctor, are you sure this patient, for example, has this allergy and so on. So doctor actually have to put in notes inside to actually bypass that alert, right? And these alerts actually written down and will be utilized in court of law. Should the case be brought up, patient put a case and say, look, why doctor did you do this procedure on me? Because the software said otherwise. Doctor will have to justify, and that's the proof. Same thing applies to AI as well. AI can suggest whatever the AI wants. In Malaysia, humans in charge. The AI is not in charge, but of course, doctor has to justify why he bypassed and took a different decision.
So the approach has to be, wholesome lah, because both you two human beings talking to each other.
Our legal structure is very clear. Legal
Yes.
framework is very, very clear.
Earn back the trust with skill, knowledge, and expertise. Yeah. Well, we definitely have to start using AI. I'm already using it.
Yeah.
It's just making everything easier.
Closing quote together, we brought up this quote: use the system well, don't let the system use you.
Use the system before system uses you. Okay, thank you.